Pelvic examination is an examination of the female genital organs. Start by explaining the procedure to the patient and asking for consent.
Clarification mariskandiyan ko ug sa karon buntag kay mo-perform di ko bimanual pelvic examination sa imuha. So ako ray sulod akong tudlo, sulod sa imong kinataw, then ako lang eksaminon kung naa ba mga abnormality sulod sa imong vagina. So dili siya sakit pero maka-feel lang kag kanang mild discomfort. So okay ra ba ma'am kung eksaminon natin karon? Asa lagi ma'am. So good na ta ma'am. Position ng tagtarong ma'am.
Position should be dorsal lithotomy with the buttocks at the edge of the examining table. Make sure patient has voided before starting. Observe asepsis by putting gloves. Remember the mnemonic equad in performing the procedure. I stands for introitus and includes inspection of the external surface of the vagina, such as the following. Observe the introitus and take note if the hymen is intact, imperforate or open, and whether the perineum gapes or remains closed. Palpate the area of the posterior third of the labia majora, placing the index finger inside the introitus and the thumb on the outside of the labium to palpate for the Bartholin gland. Evaluate for pelvic organ prolapse by asking the patient to cough. Put lubricant in the index and middle fingers. Introduce the lubricated fingers of the dominant hand into the vagina, directing them posteriorly. The thumb should be pointing up or folded under to minimize the discomfort for the patient. The C stands for cervix and includes evaluation of the position, architecture, consistency, and tenderness, especially on mobility of the cervix. Test the strength of the perineum by pressing downward on the perineum and asking the patient to bear down. Ma'am, pungi daw akong kamot, ma'am. The opposite hand is then placed on the patient's abdomen. Press on the infraumbilical area to elevate the uterus by pressing up on the cervix and delivering the uterus to the abdominal hand. Evaluate for position, architecture, size, shape, symmetry, tumor, consistency, tenderness, mobility. Next, examine the agnexa by placing the vaginal finger in the lateral fornix, so the abdominal hand is placed just medial to the anterior superior iliac spine. Do it on both sides. Outline the agnexa and note for tenderness, masses, and mobility. Withdraw middle finger from the vagina and insert into the anal canal. Evaluate the tone of the external sphincter muscle, tenderness, tumor, irregularities, fixation, or mobility in the rectovaginal septum and rectum. Remove fingers and check for any alterations in color or consistency of the vaginal discharge.
Okay ma'am, human na to ma'am. Thank you jud kaayo ma'am sa ibang panahon. So tagaan lang tikal tissue ma'am. So ay muhang findings di ay ma'am.
Properly annotate the report of the findings.
Ma'am, kay normal naman tanan, wala naman tay abnormalities sa imong introitus, sa imong cervix, sa imong uterus, adnexa, then wala na pud kay mga abnormal discharges. So maayo ra kayo imong result.